Is technology incompatible with healthcare humanization processes? Many people are wondering about this, and today, in this video, I want to share with you how technology, if it has a very clear purpose in the care of people, can become a key success factor in any humanization plan. And for this, I will be joined today by two luxury guests. On the one hand, we have Eva Aurín, Head of Innovation at the Vall Hebron Hospital in Barcelona, and on the other, Roger Pastor, Director of Innovation and Technology at the HUMANIZATION School. Join me in this adventure. My name is Albert Cervera, CEO of Simbiotia, and I am specialized in the transformation and humanization of organizations, from hospitals, nursing homes, special care centers to companies. As I have already said, humanizing is personalizing care. It is putting people at the center of organizations. In this video, I am not going to say much more, but if you are interested in knowing a little more about this concept, when I approach any project to humanize any organization, whether it is a hospital, a nursing home, or any other type of care entity, I always focus on four main areas. The first is the physical spaces, the second is everything that has to do with caring for people, the third is any type of activity that can be carried out, and the fourth is all the processes and specifically the technology that can be applied. And in this video, we will talk especially about the fourth point. We live in an era in which technological transformation is acquiring unimaginable speeds, and this speed is becoming exponential since the global pandemic we are living through. Many wonder if these technological advances, this digitization and technological transformation, have any risk in the long-awaited and sought-after humanization of healthcare. Because we cannot forget that many of the technological advances have led to create an abyss, sometimes between institutions and people, creating situations of dehumanization. But this has not been at all the fault of the technologies, but rather of the approach or the objective of these technologies, or even the use that has been made of them. And today I want to share with you how technology can indeed be a catalyst for this humanization of healthcare by sharing some interesting examples. The first example is the Vital Minds project of the Philips company, which consists of a series of devices, software and processes to reduce episodes of delirium, hallucinations, confusion or disorientation experienced in ICUs. All this through the correct management of elements such as light, respecting circadian cycles, and sound, reducing noise levels in the patient's environment. In this way, the developers aim to make ICUs as welcoming as possible. The following example is from a project we carried out to transform a waiting room in an oncology hospital. In this project, we realized that one of the sources of the most anxiety and stress for both patients and their companions was the fact that they had to be constantly looking at the screen to make sure they didn't miss their turn. And we are talking about waits of more than 5 hours. Imagine what it's like to be constantly waiting for 5 hours, with the fear of missing your turn. So here what we proposed was the implementation of a very simple application, where when you arrived you could check in, and that way you could see from your mobile with a very simple application how much time you had left for your turn. That meant that if you were waiting 5 hours, you could leave, go for a walk, go read, go eat, without worrying about missing your turn. Then you could see how much time you had left, and when you saw you were close, you went back to the waiting room. Look, such a simple technology, something that cost only 200 euros to implement, solved a big problem they had in that waiting room. The next example is the so-called digital hospital rooms. Here the idea is that the patient has access to electronic devices such as tablets or smartphones through a Wi-Fi, where it is allowed in this way to give care and the necessary resources. From there, the patient can consult from their appointments, from medical reports in real time, even medical recommendations that allow them to improve a speedy recovery. But there is also a more important part of all this, which is to improve communication. That is to say, for example, that the patient can make a video call to the nursing staff without having to leave the control center if he has any doubts or any specific need he may have. A project carried out by the Hospital Universitario La Princesa provides a well-known virtual contact for the relatives of surgical patients, since stress is often not only for the patients but also for the relatives. And here what it allows with this virtual contact is to give information in real time through messaging platforms such as could be WhatsApp or Telegram. In this way, we avoid those long periods of time without information that generate so much anxiety and so much stress. And now I'm heading to Hospital Vall Hebron in Barcelona, where I'm going to meet with their innovation manager Eva Aurín, who is also a professor and coordinator of the Master in Health of the SEI, and she's going to talk to us about how innovation and technology can improve healthcare.
I'm Eva Aurín and I'm responsible for innovation at Vall Hebron Hospital. People think that technology is the solution to things and that it interferes with other ways of working, and the opposite is true. Technology is just another tool, like a scanner or an ultrasound scanner. It is a tool that allows us to improve patient care, and what it does is the opposite. It tries to improve the care we give to the patient with methods that are more efficient. The patient is offered methods and solutions that provide a better quality of care. And in a more humane way, this is also very much taken into account. Now, when a project is carried out and the technology is implemented, the patient is also taken into account so that he or she does not feel invaded and feels it as a benefit and not as a threat. So I think the other way around, what technology provides are complementary tools. It is here and it is here to stay for many years, and there is no one who can stop it, and we have to use it. And how is it going to help us? For example, artificial intelligence. I am involved in several projects in which we are going to try to help in the diagnosis so that the patient can be diagnosed earlier, so that he can be treated earlier, and his quality of life is better. At the end of the day, that is what humanizing is. It is trying to get better treatment as soon as possible so that the patient feels better. Using virtual reality in children when they are going to undergo an invasive procedure such as a lumbar puncture or a blood draw. When you see the child who previously had to be sedated because there was no way to draw blood, and you put virtual reality on him, the child is looking at the fruit and the birds, and they are drawing blood, and he is not paying attention to anything but what he is seeing and hearing. Other projects we are working on, for example, is a projector that we are going to use for children without palliative care who cannot leave the hospital. We are going to set this stage for them so they can travel to the park or so they can be at a friend's birthday party. Another project I've come up with is to prepare the patient for the day of their surgery. When you're going to have surgery, the fear you have of the operation itself, but also the fact that you don't know the operating room, you don't know what they're going to do to you at that moment. If you can prepare the patient with virtual reality and simulate the trip they are going to make and see the operating room, and what the operating room is like on the day of the operation, they will continue to be afraid because nobody is going to take that away from them. But the anguish of seeing where they are going to put me, what the operating room is like, where I am going to go through, you take it away, and this is humanization at the end.
Let's now meet Roger Pastor, digital entrepreneur and augmented reality specialist, who, as Director of Innovation and Technology at the Human Business School, trains healthcare workers in ethics and professionalism. Roger, I would like to ask you as a technology expert if you consider that technology and humanization are compatible or not.
Well, it's not that they are incompatible or compatible. It is that technology implies, since we were in prehistory, technology, every invention and every innovation we have had has served to improve our quality of life, which leads directly to humanization. That is, technology can be used in many ways, and there is a debate about whether it is used badly or well. We are afraid of what can be done with technology. But technology in and of itself, inventions are usually for the better. Things that humans can't do for ourselves. Therefore, I think the focus should be on humanization.
Roger, could you explain some current examples of the use of technology to improve the humanization of healthcare centers?
The truth is that in the school we are very fortunate because we are in a position where there are many people with incredible technological projects that do wonderful things with incredible creativity to improve the patient experience. For example, they would be cases like Sabana or IOMED, which are companies that are using artificial intelligence to do a world of things. They are artificial intelligence engines, algorithms that facilitate the introduction of the medical history in medical visits. And this is what generates this facilitation through natural language processing that allows the physician to have it all easier when it comes to entering it in a consultation. It allows the doctor to spend more time and be more focused on the patient in front of him and not so focused on the software to enter the data well. There is a project that when we saw it, we thought it was absolutely wonderful. It is a prototype that Hyundai made with the Children's Cancer Unit in Barcelona, and it covers the experiential part of the transfer from the child's room to the treatment room. Normally, when they go to pick them up at their room, the stress levels, the anxiety levels are very high. What this prototype does is that they put the child in a car, and through facial recognition, it measures their heart rate and measures their breathing. The software and the doctor behind it can measure the level of anxiety and stress that they have during the trip. Then, little by little, as the child goes through the hospital corridors, the same software, the car talks to them, plays music, distracts them, and puts them in an environment where those stress levels gradually decrease. When the software detects that all this is okay, then they can be taken to the treatment room. It's a way of dealing with moments that are, again, very traumatic, so how technology helps make the patient experience, and in this case the children's experience, much better.
And tell me, Roger, and just to wrap up, where do you think the future of technology in healthcare facilities is going? What paths do you think should be taken, or where is it going?
For me, the future is exciting. Sometimes when you hear the words we were talking about earlier, it can be a little scary, but I think nothing could be further from the truth. I think we are heading towards a very virtual future. Virtual reality is going to surround us in every way we can imagine, and we will be very accustomed to using virtual reality headsets to immerse ourselves in other worlds and other environments that will benefit our experience, whether it's in waiting rooms, whether it's during treatments. And it's also a future with a lot of artificial intelligence. I think what's been shown is that kids who are in school now, the biggest skill they're going to have in 15, 10, 20 years will be the ability to interact with artificial intelligences. Does that mean they're going to take jobs away from them? No. It means that there are many tasks that we humans do today that are repetitive, that don't add value, or that are tedious, that an algorithm can do it, and that in the end, these algorithms allow us to provide the value that a machine cannot provide, that human-on-human value, and that we focus on taking care of people, on giving them affection, on dedicating time to them, which in the end, when you are in the health sector or in the pharmaceutical sector, it is very important to have the affection and time of people. I think that's what technology is there for, to help us become more human, even though sometimes it may seem the opposite. Technology will help us. It will help us to be more human than we are now.
The Knowledge Society offers us the possibility of recovering the value of the clinical act, driven by the opportunities offered by technological development. But we cannot ignore the fact that it can also become the ally that consolidates a dominant paradigm of medical care based on its commodification and dehumanization. Whether it goes one way or the other depends on each and every one of us. If you have any technology projects that have helped humanization that you would like to share, post them in the comments, and also if there are any areas that you think should be improved or changes should be made. Like the video if you liked it, subscribe if you want to receive content like this, and most importantly, have a nice day.